welcome to this episode of our G podcast series. So, we have been doing this series with eminent speakers from various international institutions who have done fellowships in various nations across the world. So, in this interesting episode, we have one other stalwart over here who has done fellowships across the globe, and I welcome Giri to give an introduction about the guest today.
Hi everyone, greetings from the Orthopaedic Research Group and Brew with Bones. So we have today Dr. Ravi Teja Rudraraju with us. He is a consultant knee and sports surgeon at the Apollo Hospital, Hyderabad. He has done his fellowships in most of the continents across the world. That's how we should put it. So he has been in Korea, United States of America and Australia. So he'll be sharing with us his experience on how the fellowship was and how did he manage to get into so many prestigious programs. Hi, Dr. Ravi.
Hi, Giri. Hi, Satish.
Yeah, so
thanks for your kind introduction. Very pleased and looking forward to have a wonderful discussion.
So let's start with your journey. Please give us an outline of your journey so far.
Definitely, it's a great experience traveling across different continents in the last around 5 to 6 years. So after finishing my residency in Hyderabad, I got an opportunity to go to South Korea to do my international orthoplasty fellowship. I got this opportunity through Indian Orthoplasty Association. So they've got some fellowships which are both inland and as well as international fellowships. So I got a scholarship for that. So I went to Hallam University, did my fellowship with Dr. Professor J.D. Chang in hip and knee orthoplasty, particularly in revision surgery and computer navigation. So during that time, I got an opportunity to kind of, attend a few of the international conferences like ISTA, which is International Society of Technology in Orthoplasty. So there I got an opportunity to meet a lot of surgeons coming from US. So I have networked with them and asked for opportunities to kind of do some more fellowships in US. And they definitely helped me with a lot of information on what all I can do to get into US. So with that background, I went back to India, did my senior residency, and during that time, I was always in touch with these people whom I met in Seoul. Luckily, I got an opportunity to go to Cleveland Clinic. So I traveled to US. I did my sports medicine fellowship there in Cleveland Clinic, followed by I did my adult reconstruction fellowship in Geisinger Clinic, Pennsylvania. So I was there for 2 years in US, and during that time I wanted to settle in US. So I was like doing my MLEs and all those things. But at some point of time, I decided myself that I want to relocate myself to India, and I want to establish myself in my place in Hyderabad. So with that, so I was started looking for opportunities, and I decided that probably I think further 2 more years of fellowships in maybe in Australia or Canada would be a good place to go, so that 5 years post residency will give you a advantage to become a consultant. So luckily with my US training background, I could easily crack the interviews in Australian Orthopaedic Association associated fellowships. So I got my first fellowship in Melbourne. That was in Malabar Orthopaedic Clinic in Melbourne. So that was a comprehensive robotic joint fellowship I did for a year, and then followed which I got an opportunity to go to Sydney. That's in University of Sydney, where I did exclusive comprehensive knee fellowship. I spent there for a year. After finishing my knee fellowship, I came back to India, and then I joined Apollo. It's been almost 1.5 years now, and I'm here focusing mainly on knee as a subspecialty. I'm exclusively into knee, and I practice as a knee surgeon and sports medicine as a broad specialty. So yeah, it was a long and interesting and very fruitful journey that I had in the last couple of years over fellowship. So here I am, and I'm more than happy to share my experiences or guide any of you people to kind of help you through your career pathways to establish yourself or to do fellowships, or you want to travel to other countries and settle there.
Thank you, Ravi. That was a big journey, inspiring to many of us, and takes a lot of persistence and the thirst for excellence to go into all these programs and then finally settle in a place.
Thank you.
So it's great that you always had the long picture in mind and did all these programs one by one systematically.
Yeah.
So how was your approach to Korea? Let's start from Korea. So you met some eminent speakers in the Indian Orthoplasty Association conference and mailed them, or how did it work?
It worked that way also, but in my case, it was basically during my residency time, I realized that if you want to kind of establish yourself in the future years to come, I decided that you cannot practice everything. You have to definitely focus on some specific area like sports medicine or maybe arthroplasty or pediatric orthopedics or whatever it is. So with that in background, I think during my residency years, I decided to kind of start presenting papers, publish some papers, also go to conferences in the national level, so that you go and meet people from national level, like national faculty, as well as international speakers who come from other countries. So for me, actually, in this part of journey of presenting papers, publishing papers, I had opportunity to present my work in Indian Orthoplasty Association. So the Indian Orthoplasty Association has something kind of like say gold medal paper or best paper award. They give for first three papers, and they award fellowships for that. So there are a couple of fellowships which are inland, as well as a couple of fellowships which are abroad. So luckily my paper was selected as a gold medal paper, and I got the gold medal for that year. And they offered me a IAA fellowship. And during that time, I also had an opportunity to meet Professor J.D. Chang from Korea, because he was one of the speakers. So I interacted with them. I kind of expressed my interest. I've showcased all my work that I've done. So he was very impressed with my work, and he said, I'm more than happy to take you in the coming slot. So at that point of time, Dr. Mandeep Dhillon was the president of IAA. So luckily, he also had very good impression on me, because I was closely working with him on a couple of projects. So everything fell in place, and I was awarded an Indian Orthoplasty Fellowship to travel to any of the international countries. Like I got an opportunity from Indian Orthoplasty Association with Australia, with UK, and with South Korea. But among all three of them, South Korea had the most duration. So it's like almost 6 months period. So I decided probably it would be much beneficial if you go and stay for more time, so that you get to learn more. So with that, I have chosen to go to Seoul, South Korea. And everything went well after that. So I was awarded the fellowship, and I was given the offer letter. So I just took the right time to travel there, and I went to that place, and I spent 6 months with Professor J.D. Chang in Hallam University.
Oh, that there is a big message to take home from your last answer. So let me try to summarize it for the benefit of the audience. So the first thing is, you had the futuristic thought that you should focus on a particular specialty to survive in this current generation of orthopedicians. So that very futuristic thought for a PG as such. So the second point is, you decided to publish your works and present them in national and international conferences at the PG level. So that's also another important take-home message for us. And you were collaborating with stalwarts like Mandeep Dhillon back then when you were doing PG. So that's another take-home message for the youngsters who are yearning to excel in orthopedics. So all these led you to a prestigious award at the Indian Orthoplasty Association conference, and which led to a fellowship in Korea. That too, you chose Korea because the duration was quite long there, right?
Yes, that's right.
So these are the take-home messages that I got to summarize from your answer. So that's very insightful and very futuristic of you.
You're very right, Giri. I think definitely that's an important point that all the postgraduates have to start thinking, because back then when I was thinking through that pathway, I was just anticipating that's how it will be. But in reality now, if you do everything, I think you will be very much difficult to kind of sustain yourself in a regular practice. So you have to be good at something, and you have to make sure that you really do good work on that.
Subspecialty based practice is going to be the future.
Yes, very true.
So how was the experience in Korea? I would like to put forth a couple of questions, like were you paid there, or did the Indian Orthoplasty Association cover your expenses, and how was the exposure there? Were you able to wash into cases, and how was the teaching there? Were you able to assist surgeries?
The Indian Orthoplasty Association definitely gave me the scholarship. With that scholarship money only, I traveled there. So all my stay and food was offered by the university. So all my accommodation and food was given for free from the university side. And my travel expenses and all those expenditure was reimbursed from the Indian Orthoplasty Association. And my time in Korea was wonderful because I got to explore a lot of newer advances, in terms of computer navigation, even in terms of revision orthoplasty, because South Korea, Seoul was very well advanced in terms of techniques and as well as technology. So first time I was exposed to computer navigation in joint replacement surgery. So my professor was very kind of me. So he allowed me to definitely scrub into the case, be the first assistant, and he also offered me to do parts and few steps during the surgery that are very, very important for a fellow to learn. So I did bits and pieces of most of the surgery, but by the end of my fellowship, I was able to do a joint replacement, like a hip knee replacement or a knee replacement by myself, because I was very confident on the steps that I was learning through over the last 6 months during the time. Although language is a bit of barrier because people speak Korean, but my work was mostly on the clinical surgical side of it, not really interacting with the patients. But I used to sit next to my professor. He used to talk to the patient and he used to always convey that into the English on what is patient saying and why are we kind of choosing some surgery to do something or something like that. So although we really don't understand the language, but still I think professors, most of the people speak good English, and then they will communicate to us in a good format. So I was able to understand most of the clinical problems and why we are choosing certain surgeries to do certain way. And for surgical point sides, I mean, every he himself or his assistants, everyone used to speak English, so it all used to be really fine during the OT time. And also, they are really very friendly people and very warm people. So they used to take me to different places for local conferences, and they used to always make sure that I don't miss my family. So they used to engage me with their family events, like inviting me for dinners and other things. So it was a great time. I had a great learning experience as well as a very much good exposure towards Korean culture, Korean food, and also to help me to travel and explore a different part of the world. It was not completely only educational trip. It was fun trip, also having a very balanced experience, wherein on weekdays you are exposed to clinical work, and on the weekends you expose yourself towards different parts of the South Korea. And by the way, it is a very beautiful country, and a lot of other Indian fellows also do fellowships in different places. So we made a small WhatsApp group. We used to discuss on that group on what to do on the weekends. So we used to catch up on the weekends, go to nice restaurants, and we used to travel. We used to go for hiking, some nice sporting events. So overall, it was a great experience in South Korea for me.
Thank you for the elaborate answer once again, Ravi. So you had a very good time, not only academically but also socially. You were able to interact with the other fellows there, and you were taken care of by the surgeon there very well. Very heartening to know. And coming to the other question, so you were able to get it through the Indian Orthoplasty Association. So
yes.
If someone is not able to get such a prestigious fellowship, what are the other opportunities? How to apply to the Korean fellowships?
These days, I think there are a lot of websites who also have a lot of information on which centers offer Korean fellowships. But the best important way is to directly meet professors who travel from there for the national conferences. Meet them, take their email IDs, and network with them, and directly apply through an email on showcasing what work have you done before, and why are you interested in doing this fellowship, and in what way doing that fellowship will change your practice or will change your career. So those are the things I think will impress any professor from any part of the world. It's not just like you want to go there and ask them, I need a fellowship. So you need to really showcase your passion and interest on why you want to do this fellowship and why you really want to work with that professor. That gives a lot of interest and enthusiasm for him also to take you as a fellow.
So the key is to travel to different conferences in India and approach the Korean surgeons who come there to deliver guest lectures.
Yes.
True. So how should your CV be? When you tell you should showcase your work, what do you exactly mean? How should a resident soon after coming out of an average college with the usual works, how can he project himself? What are the prerequisites you think?
So basically, he can, like, say for example, what I used to do is that before meeting someone, at least kind of look through his profile, what kind of work he has done, what has he published, and what is he good at, so that when you speak, firstly you can start your conversation on, like, I've read your paper, or maybe I've listened to your lecture on this. It is very interesting to see you doing this, and I would think of doing this way, and on this space I've done this work in terms of, like, maybe presenting or publishing or whatever, so that you're trying to really engage with him. It's not like you're going and saying that you're a great professor and I really want to work with you. Not that way. So it's rather kind of showing that effort that you have read through their work, and also kind of making them also feel happy that genuinely you're interested in pursuing the fellowship with them. So it doesn't matter you have to publish, like, there's no one number that you have to mention to say that they have done this and that. Even one paper or one presentation you have done which can really resonate with him is what is more important than the numbers itself. So I think more importantly is to do your homework, see what that professor has done before, what is he good at, and why you really want to go to him, and what have you done in that space is what all matters.
Thank you, Ravi. That's again an insightful answer. So the opportunities that you get in PG are not limiting your possibilities after residency, right? So even if you have done a couple of presentations or a single publication, you can still do your homework about a particular speaker and then approach him and talk to him in the most pleasing way, so that he gets interested in you.
Yes, very true.
Okay, so what are the visa processes on going to Korea? How long it takes after you get approval from a particular program? How long it takes for you to get the visa approved and travel there?
I don't think it will take more than 1 or 2 months time. Once you get it, I think there are a lot of visa travel agencies which will help you with that. I approached one of the travel agency in Hyderabad. They were really helpful. I just went and showed my offer letter, and I told them that I want to go to this fellowship. They did everything for me. They just asked me what all documents they needed, and then I got my visa in a month or so. I mean, it was not a really big task, and there will not be any interviews or anything for Korea. So it's more of submitting your documents and getting the visa approved.
So it's quite easy when compared to Canada or Australia
Definitely.
or US.
Yes, definitely.
What are the options after finishing a fellowship in Korea? Is there an option to immigrate there and practice there as a surgeon?
I really don't think so, because one, Korean language is a very big limiting factor for us. But also speaking, I haven't come across any Indian doctors who are settled there as a practitioners. So in that way, I don't think any people can immigrate to that country and settle there for long term. So it's more of a fellowship experience that anyone can look into.
Okay, so immigration is quite difficult.
Yeah, difficult, and also not that encouraging for a doctor who's trained in India to go and settle there, because I think at the end of the day, you should be able to communicate in that language, which I think is a bit difficult at this stage if someone wants to do.
Okay. So going back to your first answer, so you were lucky enough to be funded by the Indian Orthopaedics Association. So do all the programs offer some amount of stipend there? And before going there, what is the cost of applying flight tickets and visa and everything? How much is the overall experience for a 6-month fellowship in Korea if you are not being paid by the Indian Orthopaedics Association?
So I think you would expect to spend somewhere around maybe 5 lakhs or something
for the whole 6 months.
Yeah, for the whole 6 months, because your stay and food is free. Most of the fellowships offer that, and it's only the travel that will cost you something. But I think even within the 6 months, if you're traveling somewhere, if you're eating out, even I don't think you end up spending more than 5 to 6 lakhs.
Okay. So is it advisable to take your spouse with you when you go?
Maybe for Korea, I think it's not for the complete period. Maybe they can visit you and then maybe a month or so they can stay with you, but not for the entire period.
So it's difficult to find a housing there. And
Yeah. So I think I think staying out and all will be a bit difficult. I think in terms of probably like traveling, visiting is all fine.
Okay. So that's all about the Korean fellowships. The questions I got, I asked everything to you. Do you want to add anything other than this regarding the Korean fellowships?
I mean, nothing like that, but I think South Korea is an amazing place to go and do your fellowships because they're very advanced. Professors are very well skilled, and it's the easiest way to also get.
Kind of very easy to apply, and the expenses are also a little on the lesser side.
True.